Now we'll talk about one of the principles of surgery. It's the dissection. It's as important as that, like the surgical knotting and suturing and tying. Okay, when we want to dissect, actually we'll start by the ring finger and the thumb. They are inside. When we want to dissect from the right side, we will hold by the left, by the forceps, and we will start dissection that one. Now, if we want to dissect on the left side, we don't need to leave it and we change direction. No, actually, still by holding the forceps, you can just enter the thumb at that side and you change the direction immediately. So here I'm changing, and again I'm changing. This is very important in a critical field, that you don't want to leave the tissue, because the field is very difficult. The dissection plane, you cannot get it again maybe if you lose it. And now we are dissecting in both directions, here and the other side. What about if we want to dissect from above? We can do like this dissection, but one of the ways is actually you do it like this. You rotate and you start the dissection, sometimes like this. It's easier too. Now what about the other? You do it like this. You dissect from here posteriorly, you hold the tissue and you dissect. This is the dissection plane for all side, left side, right side, and this is from above, and now this is from below.